Go ahead, Alex. Introduce yourself. Tell me what your position is here at the center.
Hi, Ali. Thank you for joining us. My name is Alex Bejarano. I'm the Director of Public Relations for the Regional Center for Border Health and the San Luis Walk-in Clinic. We're a 501c3 nonprofit charitable organization serving Yuma, La Paz, and Mojave counties.
So are you guys seeing any kind of irregular numbers? I know we had 4,000 people over a really busy weekend with MPP being reinstated. So did you guys have kind of an influx of people as well? Were you able to handle helping additional people that were coming in, or what did your last couple days look like?
They've kind of remained steady.
Okay.
We accept people as fast as Border Patrol can process them. So, if they only process 30, then we only take 30. Today they processed 160 between Border Patrol and ICE. So that's how many we took today. And that's equivalent to 3 buses. Okay. So one bus holds about 54 people. And we have 4 charter buses on standby, ready to help us with these people. Today, we do kind of a survey amongst the refugees, asylum seekers. We do a survey if they're ready and have sponsors and family ready to buy them their plane ticket, then we'll send them directly to Phoenix Sky Harbor International Airport. If they're not ready to travel, they don't have the means or they don't have the money to purchase their ticket today, and maybe they can tomorrow, then we have agreements with shelters, one in Riverside County, California, which we work really close with, and we'll send a bus there today with the group that doesn't have the means to travel today and that need just one extra day to regroup and get their situation in order.
Alex, thank you for that insight. We haven't really been able to understand the process a lot because there has been a point of contention with NGOs. But tell me what you guys are doing. You're helping these people, as
Absolutely.
I've explained to people, that this isn't a situation where you are trying to enable illegal activity, but you're trying to be human in this situation. So explain a little bit about that.
Absolutely, Ali. This is a humanitarian crisis, and we're helping in a humanitarian way. You know what we do once processing has been complete at Border Patrol, their biometrics, their background checks, all that kind of stuff that the officials at ICE and Border Patrol do, then they release them to us. And we started this number one because it was a humanitarian crisis and we were in the middle of a pandemic. And so in an effort to help mitigate the spread of COVID-19, we didn't know, these people are coming from foreign countries. We don't know what virus they're carrying, if they're carrying COVID or just the common flu or whatever.
Dengue or tuberculosis. We've seen that. It's scary.
But we wanted to help protect our community because we'd worked so hard as a healthcare agency. We're the leading nonprofit in Yuma County, in Yuma, La Paz, and Mojave counties doing testing. To date, we've tested over 160,000 people in Yuma County, that of the total amount of people that have been tested. And to date, we've vaccinated over 60,000 people. So we have taken the lead on anything COVID related in Yuma County. And so when Border Patrol started releasing these people on the streets of Yuma, we thought, wow, we can't let that happen. Number one, Yuma doesn't have the infrastructure to support those kind of releases. We don't have shelters. We don't have a major airport. We don't have a major bus station. So these people were just kind of left to their own devices. And so we said, let us help. And we worked it out with Border Patrol, and that's where we stepped in. So now what happens is Border Patrol, instead of releasing them onto the streets, which nobody wants, because there's, like I said, there's no infrastructure for them to travel. So Border Patrol releases them to us. We test them for COVID-19 with a rapid test. And of course, we can't force them. It's all voluntary, but 99.9% of them agree to get tested. And we test them for COVID. If they're positive, then we ask them to quarantine. And about 99.9% of them agree to quarantine with us. We go and test them every day. And once they're negative and safe to travel, then and of course we provide any medical care they might need while they're here. Mm-hmm. And once they're negative and able to travel, then we help them, we load them back onto our charter buses and get them on their way to see their families or their sponsors wherever they're going.
So what about the vaccine side of things? Are we vaccinating people here, or what are we doing?
A lot of them, we do have vaccines available. For refugees, we've been wanting to just use Johnson & Johnson because it's a single dose and we don't know if they're going to have access to the vaccines wherever they're going. So if we do have Johnson & Johnson's, we do offer it to them. Some of them take it. Some of them have already been vaccinated with the Oxford AstraZeneca on the Mexican side, or the CanSino, or the Sputnik. And so at that point, we don't want to mix any of the vaccines until they get to where they're going and they can see their doctors or whatever county health officials in that area.
Okay. Now I know you see this question coming, and it shouldn't be a tough one, but it's one that everybody is always going to wonder: is where are you guys getting the funding? Are you using any government funding to this? I know you are an NGO, but I know there are funds available through different acts and different things. Excuse me. Is there any government funding being used to help in this operation?
Right now, everything that we've done, and since the end of, I believe, the end of February, we've paid for out of the agency's pocket. We would like to get reimbursed, and we are working with FEMA to see if they can provide some reimbursement. We know that the reimbursement won't be 100%, so we are going to most likely take a loss. But again, this is a public service that we're providing for our community in an effort to avoid the spread of COVID and in an effort to stop the releases of asylum seekers into the streets of Yuma, because again, Yuma does not have the infrastructure to support those kind of releases.
Right. You guys are doing what seems like an impossible task. It's a really tough job that you guys, like you said, you're up against a lot of critics. And so with that said, you're talking about when the families are ready to see them, when they're ready to receive them. I've talked to some people who don't have people on the other side, in the States.
Yeah.
And with the migrant caravan I was walking with, some people don't have sponsors. I've even had people have my card reaching out asking if I can help them find somebody. So what does that look like? How are we finding sponsors? Are we paying people? Is the government finding sponsors? Like, how do we find these people out of thin air to send these folks to? I guess if they don't have a family member.
We haven't run into that problem. The majority, thank God, the majority of the people that we get, in fact, all of the people that we get have either a family or a close friend that they're going to, and that's all listed on the paperwork that immigration releases to them. It says basically you're not a legal resident, but you are given this A number and this court date and this address where your family lives, and that's where you need to be until your court date. Okay. So we haven't run into that problem.
Okay. So I know that you have absolutely been hammered with negative things. It is a tough situation for you guys. So what do you feel? You've been doing this job. You guys started this because of the pandemic with the intention of keeping the community here safe, not necessarily to enable a situation, but people, say that these NGOs are complicit in human trafficking. How does that make you feel when you're standing out here telling me like you're doing a service for your community?
I think that the Yuma community is grateful for the work that we're doing, and I think that they know, and if not, I'd like to tell them that, obviously we are not complicit in human trafficking. We are working with Border Patrol officials. I mean, these people have been processed, their biometrics have been done, their background screenings have been done, and these people are the ones that are deemed okay to come out into the community and wait for their court date. So the Border Patrol and ICE is following a legal process, and that's just the law of the United States. Mm-hmm. And so they're following the legal process right now, regardless of how these people got here. That's what they have to do, and we are in this. We have a really close working relationship with the Yuma Border Patrol and the ICE officials, and we're doing this to help them out because they're overwhelmed in their facilities, and they don't have room to house all of these people coming across. And whether people think that it's good or bad, the bottom line is it's happening, and so something needs to be done, and we're happy to be in a position and to work for a strong agency that's able to support this type of operation at this point in time.
So do you guys, and I know this is a sensitive question, do you deal with unaccompanied minors? Do you have those in your pathway? Is that something, because I know that once unaccompanied minors basically go into border custody, we kind of don't see them again on our side.
Yeah.
Is that something you are seeing? Do you guys take care of the unaccompanied minors, or can you tell me anything about that?
As far as we know, no, we don't get any unaccompanied minors. We only get either single male or female adults or family units from Border Patrol. Okay. As I understand it, the unaccompanied minors are turned over to the Department of Health and Human Services at the national level, and then they deal with getting them reunited with their families, but we have nothing to do with unaccompanied minors.
Okay, is there anything else you want people to know about your operations, what you guys are doing, what your issues or mission is here in Yuma?
Sure. I mean, the Regional Center for Border Health and its subsidiary, the San Luis Walk-in Clinic, we've been committed to improving the quality and access of healthcare along the U.S.-Mexico border for the past 30 years. We have operations in Yuma, La Paz, and Mojave counties in Arizona, and we are just a healthcare agency. But above all, I like people to know that we're a public service agency, and if we can't do it, we know we can refer you to anybody that can. So we want our patients to be healthy and happy, and to be productive members of our Yuma society, and we're real proud of everything that under the leadership of our CEO Amanda Aguirre, we're really proud of everything that we've been able to accomplish, and I think that's about it.
Now, Alex, with what do you guys help? Regular's not the word, but do you help Yuma residents, like citizens here, or is it mostly migrants? What is?
No, our clinics are open to everybody,
okay.
and the migrant situation is very new to us.
Has it impeded on your ability to help your citizens here at all?
No, not at all.
Okay.
Our clinics are 100% fully operational. In fact, we just during the pandemic, we opened a 64,000 square foot facility in San Luis in partnership with USDA Rural Development, and it has a outpatient surgery center, primary care, all of our clinics, and we have 4 medical mobile units that can be deployed to anywhere, are fully licensed and fully 100% combined with between behavioral health and primary care.
Wow. Okay. Now, my final question would be, with these folks that are here right now, when you guys are going to process them, I'm trying to figure out how to ask this in a way that's not going to be offensive. Are you guys providing them with any funds or any way to get to their next destination if they don't have the means themselves?
No, we're not. Okay. If we have in the past, just in extreme situations.
What would an extreme situation be? Walk me through that.
So someone that's like in a wheelchair, or that's someone that is released from the hospital to us, and that, for example, someone needed a portable oxygen machine that the hospital purchased for them, then we help them in those cases. But for the most part, people that don't have the means to travel, as I mentioned earlier, they go to a shelter, and then the shelters help them get to their final destination.
Okay, wonderful. Okay, Alex, thank you so much.
Thank you.
I truly appreciate